Welcome to our channel. In this video, we'll be discussing some of the most frequent surgeries performed in urology: radical prostatectomy, nephrectomy, and laparoscopic surgery. These procedures play a critical role in treating conditions like prostate cancer and kidney disease. Radical prostatectomy: what it is and why it's performed. A radical prostatectomy is a surgical procedure to remove the entire prostate gland, often done to treat prostate cancer. This surgery is typically recommended when the cancer is confined to the prostate and hasn't spread to other parts of the body. Preoperative preparation. Before the surgery, the patient must undergo several preparatory steps. 1. Medical evaluation. The doctor will conduct a thorough medical review, including imaging and lab tests, to assess the patient's overall health and the extent of the cancer. 2. Fasting. The patient is usually instructed to fast for 8 to 12 hours before the procedure, particularly if general anesthesia will be used. 3. Surgical area preparation. The area around the prostate will be cleaned and prepped for surgery. Postoperative care. After the surgery, several important post-op care steps are necessary. 1. Pain management. Pain is usually managed with medications prescribed by the healthcare provider. 2. Catheter use. A catheter will be placed to allow urine to drain while the body heals. The catheter is typically in place for 1 to 2 weeks. 3. Monitoring for complications. Watch for signs of infection, bleeding, or blood clots. Follow-up appointments are critical to monitor recovery and address any issues. Potential risks. 1. Urinary incontinence. Some patients may experience difficulty controlling urination after the procedure. 2. Erectile dysfunction. Nerve damage during surgery can lead to issues with erectile function. 3. Infection or bleeding. As with any surgery, there is a risk of infection or excessive bleeding. 4. Blood clots. There is a small risk of blood clots forming in the legs or lungs, deep vein thrombosis, or pulmonary embolism. Nephrectomy. What it is and why it's performed. A nephrectomy is a surgical procedure that involves the partial or total removal of one kidney. It is commonly performed to treat kidney cancer or severe kidney damage caused by trauma, infection, or other conditions that affect kidney function. Preoperative preparation. 1. Imaging studies. The patient will undergo imaging tests like CT scans or MRIs to assess the condition of the kidney and determine the extent of the damage or cancer. 2. Fasting. The patient will typically need to fast for 8 to 12 hours before the surgery, especially if general anesthesia is used. 3. Anesthesia. The surgery is usually performed under general anesthesia, meaning the patient will be asleep and pain-free during the procedure. Postoperative care. 1. Pain management. Pain is managed with medications, and the patient will likely experience discomfort around the incision site. 2. Monitoring kidney function. If one kidney is removed, the remaining kidney is monitored to ensure it is functioning properly. 3. Hospital stay. The length of stay in the hospital varies, but patients typically remain for several days to ensure there are no complications. Potential risks. 1. Infection or bleeding. As with any surgery, there is a risk of infection or excessive bleeding. 2. Decreased kidney function. With only one kidney remaining, the body's ability to filter blood may be reduced, though most people can live normally with one kidney. 3. Hernia or incision issues. There is a risk of hernia formation or complications with the healing of the surgical incision. Laparoscopic surgery. What it is and why it's performed. Laparoscopic surgery is a minimally invasive surgical technique that uses small incisions and a camera, laparoscope, to guide the surgeon. This type of surgery is commonly used to treat a variety of conditions, including kidney tumors, benign prostatic hyperplasia, BPH, and other urological disorders. Preoperative preparation. 1. Medical evaluation. The patient undergoes a full medical evaluation to ensure they are fit for surgery. 2. Imaging and testing. Diagnostic imaging, such as CT scans or ultrasounds, is often performed to help plan the surgery. 3. Fasting and anesthesia. The patient will fast for 8 to 12 hours before surgery and general anesthesia is administered. Postoperative care. 1. Pain management. Since the procedure is minimally invasive, pain is typically mild and managed with medications. 2. Recovery. Patients often experience a quicker recovery time compared to traditional open surgery, with most returning to normal activities within a few weeks. 3. Monitoring. The small incisions are monitored for signs of infection, and follow-up appointments are scheduled to track the patient's progress. Potential risks. 1. Infection. As with any surgery, there is a risk of infection, though it is lower due to the smaller incisions. 2. Bleeding or organ damage. There is a slight risk of damage to surrounding organs or blood vessels during the procedure. 3. Conversion to open surgery. In some cases, the laparoscopic procedure may need to be converted to traditional open surgery if complications arise. In this video, we've explored 3 common surgeries in urology: radical prostatectomy, nephrectomy, and laparoscopic surgery. Each of these procedures plays a crucial role in treating serious urological conditions, helping improve patient outcomes. Remember to follow the postoperative care instructions closely to ensure a smooth recovery and prevent complications. And if you found this video helpful, don't forget to like, subscribe, and hit the notification bell to stay updated with our latest content. Thank you for watching.